On.
Alright, so.
Louder.
Okay, so I'm going to talk about chocolate poisoning in pets, and I'm going to talk about the effects of the toxicity, and I'm going to talk about the treatments for it. Okay, so whenever you're trying to figure out why is chocolate poisonous to pets but not us, you got to look at like what it's made at. Chocolate comes from the roasted seeds of Theobroma cacao and contains the stimulants caffeine, theobromine, and those are all poisonous to cats and dogs. The main reason why chocolate is poisonous to our pets but not us is because the dogs and cats metabolize the theobromine more slowly than us. Chocolate can also be potentially poisonous to humans too. So it's only at a higher lethal 50 dose than for cats and dogs. So the lethal 50 dose, if you remember, is the dose at which 50% of people or animals will die. The lethal 50 dose is usually calculated in the milligrams of poison per kilograms of body weight. And when we look at the ranges for the humans, cats, and dogs, we see that we have 1,000 kilograms and milligrams in humans, which is a lot compared to the cats, which is 200. But we're not usually concerned with cats and chocolate poisonings just because they don't usually go for chocolate. There's some that will eat anything, as you probably know, but usually they don't. But for dogs, it is a really big concern, and it only takes 300. And they're usually attracted to the sweetness of chocolate. So the concentrations of chocolate, so whenever an owner would contact you saying that they think that your dog has ate chocolate, you would want to ask them what is the size, how much chocolate did they eat, and the concentration of the chocolate, because all of those will depend on the risk and the severity of the toxicity. So white chocolate's going to be the least harmful. It contains too little theobromine to cause severe poisoning, but it's high in fat and still can cause vomiting, diarrhea, and pancreatitis, so you still want to watch out for your pets getting a hold of that. Milk chocolate, mild toxicity will occur at 0.7 ounces per pound of body weight and ingested, and the severe toxicity will occur whenever 2 ounces per pound of body weight is ingested. So that means that 1 pound of milk chocolate can greatly affect a dog that is less than 20 pounds. And then dark chocolate, mild signs of toxicity would occur whenever you have 0.3 ounces per pound of body weight. And severe toxicity would count whenever you have 1 ounce per pound of the body weight. So in that way, you could look at it as 6 ounces of dark chocolate can greatly affect a dog that's 20 pounds or more. And then baking chocolate is the worst. It takes about 0.1 ounce per body weight to cause severe toxicity, and so just 2 small 1 ounce squares of baking chocolate can be toxic to a 20-pound dog or more. So one of the main reasons why theobromine is very dangerous is because it has a half-life of 17.5 hours. And the half-life time is the time that's required for the concentration of a substance in the body to decrease by half. So theobromine can undergo enterohepatic recirculation and can be resorbed by the bladder wall, which makes it keeps it in the body longer and extends probably the half-life. And then clinical symptoms will usually develop to 6 to 12 hours after ingesting, but I saw some sources say that it can adjust even after an hour to 4, but it's just not that noticeable. It's just strange behavior at that point. So, it can last all the way up to 72 hours. And then these are the symptoms, and one of the biggest ones you want to look for is severe hyperactivity. And you want to also look at the heart rate. Those are the 2 biggest symptoms. Oh wait, no. I knew I would mess up.
Oh, that's okay.
Where do I go
There's
back?
a screen down here, that screen right there. I think we'll get you back to it.
Okay. All right. So back to this. So the veterinary care. So for tests, if you bring your animal that you think has ate chocolate to the vet, they will want to run a complete physical exam that would include the chemical blood profile, the electrolyte panel, and the urinalysis, just to make sure that it is chocolate toxicity that's the problem. Blood can also be taken to test for the concentrations of theobromine to make sure that the chocolate is the reason that your dog is having the toxicity problems. And then an ECG will be used to check the heart for any abnormalities in rhythm and conduction of heartbeats, just because increase in in heart rate and cardiac failure is a symptom. And your treatments, you'll want to the main time period that you will really want to treat your dog is within 1 to 2 hours of gestation. This is the best time to do these things. And you want to use aromatics to induce vomiting, so you can clear it out of the body as much as possible. Then you also want to use gastric glargate, and you would want to use activated carco to prevent absorption. And if it's really severe, you want to do that twice. You want to run active carco through the body twice, and that's going to absorb the toxins from the GI tract and help it pass along without it being absorbed by the body. And then the rest of the symptoms that you would want to do, you're going to mainly want to treat the rest of the chocolate toxicity with just symptomatic medications to control any occurring seizures, the slow heart rate, and to treat acrothermia, irregular heartbeat. So you also want to use IV fluids for dialysis and to keep the pet hydrated, because you want to keep the bladder empty since it can be resorbed through the bladder, and it will put that. And then after your pet, if it's making signs of improvement, when you get to take it home, you want to keep it on a bland diet for several days after the treatment, just so it will, because it went through so much stress on the GI.
And that's your story.
That's it.
Yeah,
It's pretty quick.
I really like your slide about how you did the chocolate, the more hazard, and
Yeah.
had the calculation for a 20-pound dog. That was good.